Over to you, Dr. Kirti.
So thank you for having me a part of your team for the last 5 years. I have a question for you. Why do you always give me the bad things to talk about? Bad communication, because that's self-explanatory. Anyway, thank you. So Dr. Madhav and Dr. Ravindran have made my task much easier because they've covered some points. So what is a genesis? कुछ भी आग लगती है तो आग बुझाने से काम नहीं होता. You have to know why the fire was burning. So poor communication or improper transference of data, of idea, is the genesis of the mistrust between the doctor and the patient in the current era. And this because of a disconnect between heart, head and hand, the 3 H's. Therefore, it is more of conflict. And optimal communication with empathy, I'm a proponent of empathy, is a solution. And empathy is just not sympathy. It is just not that you're born with sympathy, you cry when the patient cries, or you feel sad when the patient is sad. It is that you go ahead and understand what the patient is feeling and try to rectify it. If you can't rectify it, if it is beyond your control, like endophthalmitis, you help the patient deal with the consequences. That's what empathy is. So the topic given to me by Dr. KP is roots of this thing. So first root is ignorance. And I would say, sorry to say, we are all doctors, we are the elite, we have a good IQ, we do not have that good an EQ. So arrogance and unwillingness to learn, and sometimes it is basically just fear of displaying ignorance. It will be both ways. And there's a very beautiful picture in which the cat thinks that she's the lion. I mean, she wants to be the lion, but she's not the lion. So you kind of think that you know everything, and that's the, in fact, fallacy of youth. When you become a little gray-haired, you realize you don't know many things. So that is the ignorance. First of all, you have to accept that I accept I'm a bad communicator, and that's the root of my problem, and that's what you'll have to accept that. Second, this is my 1981 class. Literally, this was my teacher, who's still alive, and she was an anatomy teacher. And this is our anatomy lesson being taught to us. And look at the anatomy lessons now. So things have changed. There's a focus on technological skills, especially for ophthalmologists. We are dependent on machines a lot, and that's important. There's nothing wrong with that. But on the other hand, we should also have focus on the effective domain. And that's what the reason of, one of the reasons, roots of poor communication is this. And this death grip of technology has reduced the human interaction. And this is starting right from undergraduation to post-graduation, and I would say even before undergraduation. Third, something you always talk about in our medical education lectures is, unless you assess it, you don't learn it. If you don't have exams, your students will not learn. If we did not have exams, we would not have learned. So same way, unless you assess something, they're not going to learn that. And the cognitive domain is assessed by all your MCQs and everything, and psychomotor by your viva and the practicals and the surgery, but the effective domain is never assessed. So that is the problem, that these communication skills have never been assessed, and knowledge and skills are more easier to assess. Time. Dr. KP has 20-30 surgeries to do, and so do the other super surgeons sitting here. You have so many patients, 1,000 patients waiting for you. Where is the time to communicate? And there was a very beautiful study. For lack of time, I'm not quoting the studies, that how much time does it take if you talk to the patient, and how much time does it take if you just tuck do a tick box exercises. The time limit wasn't very different. Then patient feels unimportant, therefore anger is just thwarted desire. If the patient feels ignored, and then the anger starts, and then doctor feels that anger, and that cycle starts. So for doctor-patient relationship, you have to have a little bit patient-centric, and therefore when you see this, anybody can read this, is it me or is it you? It's both. It's me as well as you. Okay, so when the me becomes you and the you becomes me, when there's a trust, then your relationship is better. And that is why all this focus on ATCOM of the medical education, just change in undergraduate, I just hope it doesn't remain on paper, it is actually done and assessed. Modern communication, many of you sitting here are on your mobile phones. What is more important, listening and okay, I'm not that important, but when you are in the OPD, we rightly said, Dr. Ravindran, that if you're in the OPD and you are on the mobile phones, you're connecting with some distant person who's sitting, let's say, Calicut or Delhi or Jammu, and the person sitting right across you, not communicating with that person. So that's not right. And the next thing is modern communication. Like this was in 1858 about telegraph. That's sudden, superficial, unsifted, too fast for truth, trivial, paltry. And this was said around more than 100 years ago for telegraph. So for now, the instant WhatsApp and the instant Twitter, everything. So this is what I was talking about. This was the light sculpture which got the Best Prize in 2019. It's called as addiction. And based on this, there is a term in Oxford Dictionary now, phubbing, practice of ignoring one's companion or companions to pay attention to one's phone. And we are all addicted, guilty. This is a very beautiful movie if somebody has seen it. Audio, please. Can I have the audio?
कभी-कभी दो बातें ना होते हुए भी हो जाती हैं.
So let's just start that.
आप लोग तो समझने की कोशिश ही नहीं करते ना. अरे भैया कभी-कभी दो बातें ना होते हुए भी हो जाती हैं.
So this is a very beautiful movie, but the why I'm talking about this aspect is that he masquerades as somebody else in this movie, and the non-verbal and the verbal languages were very important. The way he's communicating कि आप कहते हुए भी नहीं कह रहे हो. So it's not what you are speaking which is important. It is your voice, your body language, and your non-verbal language which is most important. And this body posture, your facial expressions, they are all depicted so beautifully in all the muses of India, and that's really important. So, and this picture tells you that communication has to be effective. So I may go to South India, or in South India I may come to North India or West India to East India, or you may go to Japan or China. But if you can have a non-verbal communication, the barriers will go away, and visual communication is the most effective. As this picture, the child has lost the mother and is just wanting to cuddle up, is telling you. And the same another thing, the child just feels that this rabbit has fallen down and wants to be picked up. So the visual cues which you give to the patient, your smile or inappropriateness of smile is the one which is important. And we do know, this is a fact, like Dr. KP said, you have to accept that we are no longer a second god on earth. Our parents may have thought that, we don't. And this deteriorating doctor-patient relationship is causing violence, and we have to understand that only person we can change in our life is us and not the patients. So use that empathy, and that's what we do. We have to be good role models. And we have to, whatever we are today are because our teachers taught us, and what our students will be what we are teaching them. So let's mind the gap. The gap is what you are speaking, what I'm speaking today and doing in the OPD or OT tomorrow. If the gap is there, then it's not going to help. Last is focusing on the negative aspects. If anybody has read this book on the cumin seed, The Life's Amazing Secrets, he talks about cumin seed. Has anybody had something stuck in their teeth ever? Your tongue keeps going to that. It forgets to do everything else. You just keep, until it is gone, you will just keep on, being very uncomfortable. So mind like the tongue, default settings drifts to the negative, and therefore, whenever a patient has a negative aspect, just forget about that negative, remove that cumin seed from your brain and your tongue, and think differently. So find and destroy all these roots of bad communication. I've shared 10 of the roots so that this leaning tree of doctor-patient communication doesn't fall. And to find the roots, this beautiful tree is just showing you the roots. Actually, you have to introspect. Thank you very much for this.
Thank you very much, Dr.